Hi, I'm Natalya with Restore Childhood, and thanks for meeting us so late on a Thursday night. We decided to launch a book club earlier in the summer because we really felt like our kids are always the ones who are having so much fun reading books at school and talking about them. And we're always staring at our phones and, chasing the news cycle. And it's really important to read things in long form and talk about them together. And one of the things that's been most incredible for me with Restore Childhood is that I've met many of these incredible authors and thinkers, scientists, I'm so excited to bring them to you. And so last month we did our first book club, and it was with Carol Markowitz and Bethany Mandel, who wrote Stolen Youth. And that was really great, and really great conversation about some of the books in our libraries and what's happening in schools. So this month we're doing something a little bit different, and our book is Fear of a Microbial Planet, which is probably about one of my very, very favorite topics, the microbiome and the immune system. And Dr. Steve Templeton, who is a Brownstone Institute author, and that's kind of how we met, is an associate professor of microbiology and immunology at Indiana University School of Medicine in Terre Haute. He was also on Governor Ron DeSantis's Public Health Integrity Committee and was the co-author of the Norfolk Group's Question for a COVID-19 Commission, which was a document that was provided to members of legislature for a pandemic response-focused congressional committee. So before the pandemic, everybody was talking about the microbiome. It was like the hottest topic. Michael Pollan, who had written books about food and mushrooms, was writing about all the germs and viruses and beneficial pathogens that live inside us and around us. And that topic really kind of picked up steam. I mean, within Steve and I were just talking about this the other day, within about 3 or 4 years, from 2012 to 2016, there were so many great books that came out. Martin Blaser, microbiologist who used to be at NYU and is now at Rutgers, wrote a book called Missing Microbes, which I actually worked on the film adaptation of. It was called The Invisible Extinction. I highly recommend it. I'm sure you can find it online somewhere. My personal favorite book of the time was An Epidemic of Absence by Columbia University journalist Moises Velasquez Manoff. I can put all these in the chat after I finish talking. There was Ed Young, who was writing for The Atlantic, wrote a book called I Contain Multitudes. There was a book called Dirt is Good by one of my favorite microbiologists, Rob Knight, who is, I think, still at UCSD. And now there's Steve's book, which may sound like it follows in all these people's footsteps, but I have to point out the fact that when our world was shutting down and we were being told to wipe down our groceries, not one of these microbiologists spoke out, and Steve was the only one who did. So for that, I am just, floored and indebted to him. So at this point, I'll stop talking because I'm not nearly as interesting as Steve. And I think that everybody should have this book on their bookshelf. And I'd like to let Steve take it away here.
I mean, I guess I could talk a little bit about how I came to write the book. I've always wanted to be an author. I've been a scientist for at least working with immunology for 25 years. Had a PhD for 15, something like that now. It's been a long time. But I've always been interested in writing a book, but hadn't found, the right topic. Then the pandemic hit in March and April 2020. And I really started to see how people behaved and was really shocked by it. It was not at all able to understand how people were handling the SARS-CoV-2 pandemic in terms of how to keep themselves safe, because it was clear that this was a really highly infectious virus and something that was going to be very difficult to avoid for a long period of time. And but yet it was obvious that there was an age stratification there, where people who were much older It had a lot of, in many cases, multiple comorbidities were highest at risk, and that kids were really not at risk. And this was something that seemed to be pretty straightforward at the beginning, but at the same time, people didn't behave as if that were the case. And so I started to think about, as Natalya mentioned, people, dousing their groceries with bleach, and people wearing masks out when I saw a guy riding a motorcycle wearing a mask. I mean, there was just behavior that really wasn't consistent with common sense, or what used to be common sense. Everyone seemed to be acting germophobic in a way, and demanding that everyone else indulge their fear in those sort of germophobic habits that everyone was expected, or in some cases even mandated to take up. So I became interested in thinking about this and being really interested in why people were doing what they were doing. So not just being an immunologist and thinking about how the pandemic would change people's immune system, or how it would how the virus would blow through the population and leave herd immunity and all those things. I was thinking about those things. I was also really interested in the psychology of how people were behaving too. So there are multiple sort of themes in the book of really, how do I explain this to myself, how things were going, and why was I different in how my thinking, and what was it about my background that made me think a little bit differently. And so that's how I came to write the book. And I did it in two parts. One, talking about the first part, which is called Fear and Germs, where it's kind of, as Natalya said, a little bit more like the books that had come out with talking about the microbiome, the exposures that we have, the fact that you can't really avoid microbial exposures because they're everywhere, inside you and outside, constantly eating, inhaling, everywhere. And not only that, the fact that as a first world society that we live in, we're actually, not only can we not avoid microbial exposures, but there are some instances where we are getting better at it, and there are some downsides to that. So I talk about that a lot in the first part. I talk about history of pandemics, how people acted in previous pandemics, and then I sort of, in the second part, try to bring that together with what I'm seeing in the pandemic, this SARS-CoV-2 pandemic. And one of the things I really thought was playing a role was the safety culture, because anyone who's been a parent in the last 10, 15 years, 20 years has seen this sort of rise of being afraid of kids being harmed by all sorts of things which are not, not quite as bad as they're made out to be. My kids go to walk to a store or something, and now they get somebody following them and telling them, you shouldn't be out, where are your parents, and things like that. So I really thought that the way children were treated during the pandemic was part of the safety culture, and part of that fear of the world being a very dangerous place for kids, and even extended to adults. And so it's kind of a combination of that, learning about microbial exposures, the sort of history of pandemics, and then how people handled them poorly, and how that ties into the pandemic we just had. And so in a nutshell, that's kind of the book. And some of you have read it, started reading it, got to various parts of it, and I'm happy to talk about anything that comes up and read from certain parts as well.
Great. So do you want to start with the first section that you wanted to read?
Yeah, sure.
Yeah, that sounds great.
The second chapter I have titled, let's pull the tab here, How to Lose Old Friends and Gain First World Health Problems, because the first chapter is about the old friends, right? So In fact, idea is that we are getting cleaner, and despite, having a large microbiome of our own and being exposed as the exposome, as Natalya was talking about, there are instances where our first world cleanliness has some downsides. So I have a section in chapter 2 called The Routes to a Cleaner, More Inflammatory Host. And that's what I'm going to read to start off. Okay, so it is clear that microbial exposures and colonization that happen early in life are the most important for immune development and changes in susceptibility to allergies, asthma, and autoimmune disease. It's not just living in a cleaner environment that matters. The chances for microbiota disruption can happen right at birth, when babies are delivered by C-section and deprived of exposure to the beneficial microbes acquired by vaginal birth. Studies have shown that babies born by C-section have a significant different path of gut microbiota development than babies born vaginally, and are at increased risk for allergies, asthma, autoimmunity, and obesity. Birth by C-section has increased dramatically over the last 20 years. Worldwide, C-sections account for more than 1 in 5 childbirths, with the highest rates in 2018 found in Latin America and the Caribbean at 42.8%. Eastern Asia at 35.7%, North America at 31.6%, and Europe at 25.7%. In the United States, C-section rates are highest in Louisiana and New Jersey, with both over 36%. The highest rates in the U.S. appear to be tied to local healthcare provider culture and practices, even for low-risk births. In Rapides Parish, I don't know if I'm pronouncing that correctly, Louisiana, 50% of all births and 47% of low-risk births were delivered by C-section in 2017, making it the C-section capital of the U.S. This is far from the goal of 24% set by the United States government and the 15% recommended by the World Health Organization. Although the number one factor behind high rates of medically unnecessary C-sections appears to be hospital culture and local obstetric practices, modern safety at all costs culture provides a convenient enabling motive. The understanding and anxiety of mothers for the health and welfare of their babies, combined with the omnipresent social pressure of the safety culture and complacency of physicians, has resulted in a failure to acknowledge the trade-offs of C-section births. And there are many, and not just for children. Women who have C-sections are more likely to suffer from health problems like cardiac arrest, hysterectomy, and abnormal placental development, and subsequent pregnancies, which can cause severe bleeding and death. Recovery from a C-section can inhibit breastfeeding and mother-child bonding and is linked to increased postpartum depression. Women are, in many places, required to undergo the procedure for subsequent birth due to increased complications. Thus, preventing a woman's first C-section is key to lowering the overall rate. That's not going to be easy. As my wife found out with her first pregnancy, women who want to experience a natural birth sometimes have to fight their lawsuit-fearing physicians and nurses tooth and nail at a moment when they are most vulnerable. As many mothers who have given birth in the hospital know, if labor doesn't progress, it doesn't take long before doctors and nurses begin suggesting interventions that, quote, might speed things up, end quote, like injections with Pitocin to induce contractions. Problem is, interventions often don't work, and once they've started, they continue until either vaginal birth or C-section. As long as healthcare providers see women in labor as liabilities and little to no downside to C-section complications, the rate for this procedure is going to be unnecessarily high. The same type of overcautious thinking also applies to antibiotic use. Although antibiotics, when used properly, are life-saving drugs, unnecessary antibiotic use remains high. Even antibiotic exposure of mothers during pregnancy and delivery affects microbiota transmission to their infants during and after birth. A large Danish study reported that 78% of mothers received an antibiotic course that spanned 4 years and included the pre, post, and during pregnancy periods. 51% received 3 or more courses within 4 years, and the likelihood of later development of asthma in their children increased 30% with maternal antibiotic use. This continues into infancy, as one study in the U.S. determined that, on average, American children received about around 3 courses by 2 years of age, 10 courses by age 10, and greater than around 17 courses by 20 years. In contrast, children in Sweden receive 60% less. It's unlikely the threat of serious infectious disease is much lower in Sweden than in the US. Therefore, much of the antibiotics that American children receive is probably unnecessary. Much like C-sections, the level of antibiotic prescriptions among doctors in the US appears to match regional culture and healthcare practices, with higher prescriptions in southern states compared to those in the West, and higher in suburbs compared to urban centers. On a personal level, it's easy to understand how antibiotics are so frequently prescribed for children. Sometimes fussy babies might have an ear infection, so why would a doctor accept even a low risk of complications by waiting for it to resolve naturally? Parents are already in the office. They're concerned their child is suffering unnecessarily, and they expect the physician to prescribe something that will help. The physician, already pressed for time and seeing upwards of 20 patients a day and burdened with paperwork and record keeping, is only happy to cut down the interaction and give in to their demands. Children continue to be exposed to antibiotics throughout their lives, not just from prescriptions, but also from antibiotic-contaminated meat, dairy products, and drinking water. Antimicrobials in humans, animals, and the environment put natural selective pressures on bacteria and fungi to concentrate and to transmit resistance genes to one another. The combination of human, animal, and crop antibiotics in the environment ensures that people and their microbiota are frequently exposed.
People have questions. Stephanie is monitoring. They can raise their hands, but it sure does seem like this country hands out antibiotics like candy. And actually, Martin Blazer has, the microbiologist who wrote Missing Microbes, has suggested that we need to create a repository of ancestral microbes so that so they don't become extinct. What do you think about that? Do you think that's a real danger, Steve?
Yeah, I mean, is he talking specifically about human microbiota that are becoming extinct?
Yeah.
Right. I mean, it's clear if you look at, they've done these studies with microbiomes of people in first world versus, places in Africa and tribes and hunter-gatherers, and I can't remember the
Hadza people. The Hadza people. The Hadza in Tanzania.
Yeah. I think that's right. Yeah. Thank you. And it's obviously a huge difference, and it probably much similar to in the hunter-gatherers to what our microbiomes used to be back in when we were hunter-gatherers as well. So I think there's some concern about that. I don't know about things going extinct because these things have a way of showing up again when conditions change and when there's disruption, certain types of disruption. It's going to be a lot of variation throughout the world, and so I'm not really sure about distinctions. I don't think about it in that way. What I do think about is how the changes in our development, especially in the immune system, is affected by the way that we are exposed to microbes right at birth and subsequent weeks and months after that. I think a very critical time period. Not just microbes itself, but also other things we're exposed to. And I've written about that as well. Food allergens and environmental allergens. The general thought process, if you take something like peanut allergies, up until about 2008, it was thought that babies should avoid being exposed to peanuts to avoid developing allergies later. But in reality, it was actually the exact opposite. About that time, people started to realize that babies that were exposed to peanut allergens were less likely to develop peanut allergies. And it was only by extending the treatment where it's just complete avoidance is what people thought was necessary to deal with babies to prevent them from developing peanut allergies. And really, that early exposure is actually quite important. And I did write about that as well. And it was one of those things where it wasn't clear at the time, but it was suspected And I remember I worked for the CDC for a while, and I remember having discussions with people I worked with there. I was part of a team called allergen characterization team. So if we were discussing it and arguing about it, then obviously it wasn't entirely clear at the time. But that's how it turned out. And I think that's true of a lot of things. I think exposures when you're an infant and even a newborn can be beneficial, and you shouldn't shy away from it.
Yeah, I mean, a researcher that I'm familiar with, Maria Dominguez Bello, has done research on vaginal swabbing for babies born via C-section. Do you think that's a good idea? I mean, to replace the microbes that they miss coming in contact with?
Right. I mean, it's one of those things where they do eventually get in contact with those microbes, but there's a delay. And how important is that period where there's a delay? I mean, in some cases, it's just a few months or a year. But when you're talking about a developing immune system, I mean, that could make a difference. So, yeah, I mean, it certainly wouldn't hurt anything, and I think it's a good idea. Although I'm not aware of studies, I can't think of off the top of my head where that was done in a very controlled way and outcomes were measured later. If anyone has anything they can add, I'd be happy to hear about that.
Yeah, they're still doing it. I think they're running it even at Mount Sinai in the allergy department for newborns. So I think it's an interesting one. And with regard to peanut allergies, yeah, when our 13-year-old was born, we were told to avoid. And I think the research had come out of Israel right around that time that they were feeding their babies bamba, which is a peanut like dusted snack, from a very early age, and had a much lower development of allergies than they did in the rest of the world. But that it took a long time. How long does it take for clinical research to filter down into practice?
And I see the comment here about the American Academy of Pediatrics, and that is definitely a good example. The peanut allergy advice that they gave for decades, probably up till about 2008. And so even then, when that happened, they didn't go the other way. They just said that they didn't need to avoid, babies didn't need to be kept from peanut allergens or peanut exposures. But there wasn't an acknowledgement that they may be beneficial, despite the fact that the studies had already come out, which I write about, and then it was also written about in Epidemic of Absence, which you mentioned, which was also, I thought, was a very good book. And I mean, that was the case where even the American Academy of Pediatrics didn't just, actually exposing newborns yet. Yet that same year, the study came out where they did there was some sort of trial where they were exposing children to peanut allergens, and the outcomes, a year later, even things like eczema were a lot lower. Other allergens, they were lower, if I'm remembering this correctly. But so it takes a long time for organizations to catch up to the science, and it isn't really the case where a single study will often change recommendations. There has to be sort of a consensus that develops over a long period of time. And that was something that I think was hard, because people didn't really understand that during the pandemic, that science moves slowly, and they were expecting things to be clear and studies to show exactly what we wanted to know right away. And there wouldn't be they didn't want to have a debate. They wanted everyone to believe the same thing. And so the speed of science didn't really match what people's expectations were. And I think that was a big problem.
Allie Krug is here, and she's a Urgency of Normal collaborator and just a public health whiz. And you had something to say too, so hi, Allie.
Hey, good evening. I love this topic. Steve, so nice to meet you. I was wondering if you saw a study that I only read in preprint. I don't know if it's been published, but it was pretty interesting. It was looking at lockdown in Ireland, and it was looking at babies born during lockdown compared to babies born prior, and the assumption being babies born during lockdown had a lot fewer natural exposures than babies born prior. So fewer people coming in and out of the house, and they actually found a difference by 12 months of age in food sensitivities and even skin allergies, things like Natalya was just talking about. And they found that protective effects were associated with, this was really interesting, multiple adults being in the home, frontline workers, so people who were actually out and about during the pandemic, and also animals and siblings. So basically, like living a normal life was protective. I'm a hockey mom, and so one of the families in our hockey rink was talking about his kid doing like his homework, which was an exposure to peanuts through, I think they were having him do like a few little Reese's Pieces or something like once a week, or maybe it was daily over weeks. I forget how much he had, but I started looking into that because I wasn't really sure what the data was on how effective that was. And it really seemed like it was better in younger kids, more efficacy in younger kids, and it had to be sustained. You couldn't just like start it and then stop it. But I was just wondering what your thoughts were on that as well, both those things.
I've not seen the Ireland study, but it is very interesting and not at all surprising. The more things you're exposed to, the more people you're exposed to, the more animals you're exposed to. I mean, people that grow up on farms are exposed to tons of different types of microbes and allergens and all sorts of things that people who live in urban, suburban centers aren't exposed to. And, there's some differences in those exposures, and we don't really understand how that relates to allergies and autoimmune disease, but clearly there's something connected. There's a connection there. And I mean, as far as exposing kids earlier, I mean, my first child, she has more allergies than the second one does. And we thought for a while that she had like a wheat allergy, which apparently she grew out of, which does happen. But she was born in the hospital. The second one we had was born at home. And I actually tried to do a little bit of exposures with like different types of like flour, like almond flour and nut flour, and I tried to put it in my wife's breast milk. So that was an N of 1 where I gave her a little bit of exposures to those things, and she doesn't have any food allergies. So that's not really a study, but that's just my anecdote of what I tried, because I really believe that that's a really critical time in life for them to be exposed to those things.
And Allie, what you're talking about, oral immunotherapy, is actually well studied, and there are many clinical trials going on right now. We participated with my daughter in an epicutaneous peanut therapy, which was a peanut patch that she wore on her back from the time she was age 6 to about 9. And you're right, these things work much better when the children are younger. The younger, the quicker, the better. For skin, it's there's some cells called the Langerhans cells, and they kind of are more further apart, so the allergen is able to be more readily assimilated when they're younger than when they're older. But OIT, oral immunotherapy, is very effective. And yes, it has to be sustained for a lifetime, because that allergy can come back anytime.
Just throw one thing that I love out there, Steve, that you might want to amplify on, because I'm by no means an expert on this, but I'm a late comer to the microbiome party, really late comer. I mean, I was thinking that, it's a little bit woo-woo, where's the science on this? And I was busy in Japan doing other things, learning Japanese for 4 years while this was really becoming developed. I come back, and during the pandemic, I started to get more interested. My attention shifted. And just this year, I've really delved into paying attention to what I eat. I'm not just a tube. I'm not just an earthworm. I really should pay attention to what goes in and how that affects the whole process. And I learned by digging into this that You all know this, I'm sure, but again, a latecomer here, 70 to 80% of the immune system is actually in the enteric immune system, in the gut. And that's really where these first exposures are. And it's so interesting to think about all of these toll-like receptors and these other actors down there trying to sort out friend from foe. And if you think about that, if you think about all of this is going on every day in your gut, I mean, all of this signaling between the bacteria, trying to figure out if this thing that you're taking in is something to be concerned about or not, it's utterly amazing and fascinating. And to think that, you know, we should be restricting our kids' exposures and really doing, like, picky eating even concerns me. Because we're just really getting exposed to the same thing over and over again. And on top of that, it's very often processed foods that the kids will eat, which is actually not good, as you all know, for the microbiome, because we're not actually feeding the prebiotics that the microbes need to eat. So then they get hungry and they go eat stuff they shouldn't eat, which then causes the inflammatory process because the cell junctions pop open and allow antigens to leak out into the body and start triggering autoimmune conditions. So it's just phenomenal. And I wish that I had come to this party much earlier and really understood this. But I'm thankful that I had a no picky eating policy in my family before. You get one food hate at a time, and that was it. But I saw, like, younger parents just seem to be much more beset by trying to handle this. I'm a little bit older than maybe some others, and it just, I wish that we better communicated just how important all of these exposures are, what we eat, what we breathe, exercise, even exercise influences immunity and influences the microbiome. It's just nuts how it's interconnected.
That's a great point. And it's amazing how little we understand, though, because, I mean, they've tried to turn this into clinical practice and try to use probiotic therapies, you know, try to find what's this magic bullet of cocktail, or, you know, for certain types of diseases, they've tried to use intestinal worms as therapeutics, or at least the type of signal of a more of an attenuated worm infection. And a lot of these clinical trials have kind of fizzled. And so it's okay to be skeptical of the science, because it's a very slow process and it's something we really don't understand. I had written a whole section about the effect of the microbiome, because one area that's really hot is this sort of gut central nervous system axis, you know, and talking about the brain and how that is affected by our gut microbes is such a hot area of research. But there are a lot of cases where, you know, it really has got two different interpretations, where it's not necessarily the hot science that you jump on may not continue to be as hot as it's being sold. You know, for instance, you know, I mean, there's a lot of talk about. I mean, I'm kind of changing the subject here, but I'm trying to stick in with, like, you know, don't overdo the ability of science to understand what's going on right at this time. But with autistic children, for instance, you've got a very different microbiome than children who are not autistic. But that's not a correlation. It's a correlation causation problem, right? Because you don't know if that microbiome change is because of the autism, or the autism is because of the microbiome change. And so they've done some studies where they've transferred microbiota from animals or from autistic patients and seen some changes in their behavior, but they don't really know. They still haven't answered that question, because there's another study that showed that one of the reasons that autistic children have different microbiomes is because they're picky eaters. And what you said, Allison, about picky eating made me think of this. You know, I have a nephew who's autistic, and there were years where had months where he's like, I want to eat only red food, or I want to eat only white food, or something like that. So those type of behaviors really can affect the microbiome, and that's not necessarily, you know, a causal thing. It can go the other direction as well. There's a question in the chat about root beef that people take antibiotics while
So it says
um,
expectant mothers are routinely tested for group B strep. If they test positive, they are put on antibiotics while in labor. I think I heard about 25% of expectant moms test positive. Can you comment on this practice globally, or is it just a US phenomenon? And I'll add, like, what's the impact of that? Is there studies on that?
right, and it's not ringing a bell right now. I mean, I understand, I know exactly why they do this. I mean, to prevent transmissible infection of the group B strep to the baby, but I don't know if there's any, developed countries where they don't do this. It would be interesting to know that. In some places where there seems to be more of avoidance of unnecessary treatments. Scandinavian countries are a good example, whether or not that's not a practice there. It would be really interesting to find that out.
I've never seen any research on that either, but I know that with my with both kids, I was group strep B positive, and with the C-section, they gave me the antibiotics, and with the vaginal birth after C-section, which I was able to achieve with the right doctor a few years later, we really didn't want the antibiotics, and she kind of pushed the nurse away and said, come back another time, like, not ready for that yet. And she was delivered with no issues. So just a sample of one, but we did avoid it at that point. So and I know, I mean, this is kind of tangentially related, but we spend a lot of time in England with my husband's family, and my kids often get sick, and they do not routinely check for strep in England. The NHS doesn't. It's not something they do. I actually had to go to a pharmacy and like ask for a special test that we had to pay for out of pocket, which was like not something they normally do. Here, it's the first thing they do at the doctor's office. So whatever that's worth. So Steve, do you use hand sanitizer on your hands and Lysol at home?
Yeah, I actually wrote about hand sanitizer in my Substack, which is the same name as the book. And it comes from an excerpt that's also in the book. It may be even the same chapter that I read from. But yeah, hand sanitizer doesn't really do a whole lot. People like to say it's better than nothing. I'm not sure if that's the case or not. It may help for some bacteria, but I know for viruses, even ones that are infect your gut, things that would be transmissible through hands and fecal oral route, and studies are pretty weak in terms of showing that hand sanitizer makes a big difference in preventing illnesses. But of course, you have a few here and there which show a positive association, and there's one I write about in the book that was actually not very well done, but it was interesting how media people jumped all over it as if it were, just definitive study that hand sanitizer, it was like prevents absenteeism in daycares or something like that. And it wasn't really a very well done study, but for something that, so you can do to prevent, getting sick. I mean, media people love those kind of stories. And so they ate it up. There was at least four outlets that covered this one study, which, other studies don't agree with, and this particular one wasn't done very well. So I found that interesting and fun to write about, because it fit along with things that we saw during the pandemic as well, with media outlets jumping on studies that were either scary or, gave people hope with something that maybe not necessarily was as effective as they were selling it.
So I have a question for you. I think I know where you stand on this issue, but what impact, both good if there was any and bad, do you think masks had on our children?
Yeah, I mean, I was really surprised that the level of enthusiasm that people had for masks. And I worked for the city for almost 4 years, and actually worked at the National Institute of Occupational Safety and Health. So the lab that I was in wasn't directly working on aerosol exposures and, you know, the famous mannequin, but I know those guys. I mean, they were in the same division that we were. And so the people that did the double mask study, you know, I know that group. They did the double mask study with the mannequins, and immediately got completely oversold by CDC and Rochelle Walensky and Anthony Fauci. And I was really surprised by how that happened. And because I had been told by these same folks back when I was there, in 2007 to 11, you know, that masks weren't a very good source control, especially surgical masks and cloth masks. And you can read, if you read in the fine lines of some of these papers, it'll say things like, the authors will say, you know, this is a controlled laboratory study. Be careful when you, you know, use that to show what happens in the real world, and read too much. Don't read too much into it is essentially what they say. And that's not exactly the opposite of what happened with the brass at the CDC and other government organizations. So I spent a lot of time reading papers that came out before the pandemic to see what the message was there, because I felt that science, and I tried to make this point earlier, happens at a very, very slow, methodical, consensus building pace, and things don't just change overnight. Politics can change overnight, and that's what I suspected happened. And when I went back and looked at many of the papers published before, it became very obvious that there really wasn't a consensus, especially around surgical and cloth masks. I mean, obviously, if you wear a tight-fitting respirator that's designed to filter very small particles, you're going to have some success with that. But otherwise, just looking at something in a laboratory and saying that it stops particles, or, you know, and it's not really representative of what, you know, daily use would be. And especially for something like children who can't be expected to wear things properly. And so that was even crazier for me, with the expectation that children would wear these, especially when other countries were much more common sense oriented about it, realizing that it would not be effective. Even the chance of them being worn properly was very, very low. So yeah, it was a huge surprise for me, and I wrote obviously a whole chapter on it called "The Face Badge of Virtue," because that's what this essentially became. And it wasn't based on science. And I gave some presentations. I was a member of a local school board advisory board for the superintendent of our county schools. And it was me and a bunch of very cautious physicians. And they were all for every type of intervention and mandate and safety measure, you know, even shutting down water fountains, you know, which I kept asking, where's the evidence that that's going to make a difference? Well, you know, children wait in line for the water fountain. I just, like, okay, we have to have evidence for these things. And for so many, there wasn't. It was just, we need to do things to make it seem like we're being safer. And that's where I came up with this term, the appearance of safety. A lot of people just call it, you know, pandemic theater or theatrical measures. But I call it the appearance of safety because I think it's very important. It was very important for schools and others to have this sort of appearance of keeping people safe, even if that's not what they were doing. And so I think a lot of the measures that we're taking, I can sort of put into that basket, and I do throughout the book.
Didn't you say that the social distancing measurement was from like a teenager's term paper or something?
Right. So some of the initial people who sort of brought the idea of locking down back and school closures, and because if you look at pandemic planning articles and studies before 2019, there was a real acknowledgement that there was going to be a lot of collateral damage to shut down, lockdown measures, school closures, if they went beyond a few weeks or a month or so. And that, of course, was all thrown by the wayside, and actually very, very surprising that it was that happened to me. I was very surprised. But the social distancing, yeah, there was and it's a story that one book that I read was called The Premonition by Michael Lewis, which if you want to read sort of a bizarro history of the pandemic, it's completely unhinged from reality, but it's very well written. It's a good book to read. That explains that some of the initial people who were advising the Bush administration, because they became interested after 9/11 in sort of pandemics that may or may not be caused by, bioweapons or something like that. And so they started to develop some of these ideas of lockdowns. And one guy at, I think he was at Los Alamos, his daughter had a science project where they built some kind of computer model of social distancing, and so he helped her with it, and they were able to show a complete break in spread of a pandemic. And and this book talks about it. Premonition talks about how once they saw this model worked, that they really thought that lockdown was a good, and school closures were going to be just the key measures. And it's just unbelievable to read it and sort of be expected to go along with that thinking. So yeah, it's really, really interesting.
You want to read that second section that you were going to read here? So it seems apropos.
Yeah, I was talking about the safety culture, and in chapter 6, I really get into it because I try to connect the first part of the book, which talks about microbes and history of pandemics and history of things like mass hysteria, and into the second part where I talk about the SARS-CoV-2 pandemic, and sort of one of the sections that really kind of puts it in relief for me and how I sort of thought about writing a book is this section in chapter 6 called The Appearance of Safety from Infectious Disease. And so I'm going to read that section, or part of that section. Okay. It happened slowly as sanitary conditions in the Western world improved drastically over the last century and a half. As I discussed in chapter 2, back in 1873, a baby's exposure to microbes would be vastly different than it is now. A vaginal birth at home and continuous breastfeeding would provide continuous sources of exposure. Solid food might be introduced with pre-mastication, the mother chewing some of the food, exposing the baby to the viruses and bacteria in the mother's mouth, as well as food antigens. Unpasteurized cow's milk, fecal contaminated water, lack of refrigeration, antibiotics treated animals, and irradiated meat would result in exposure to billions of bacteria every day. Exposure to the microbiomes of farm animals and multiple siblings common in those times would also contribute to an environment bursting with microbes that we specifically evolved to inhabit. Obviously, we don't live in that world now. We clearly receive great benefits from improved sanitation, especially with reduced incidences of gastrointestinal diseases. Babies born now are very likely to live past the age of 2, and women are much less likely to die during childbirth. Back in 1873, when a child died in the United States, it was a tragedy, but it wasn't rare. It is rare now. An 1873 death from infectious diseases was poorly understood and often attributed to an act of God. The possibility that an infection could be prevented or even treated once it had been acquired was not considered by most people. The germ theory of disease had not been established, and the miasma theory was still predominant. Diseases were thought to be transmitted by bad air. There was no safety culture. People had to accept that they were subordinate to their own environment and not masters of it. Today, the modern world suffers from problems indirectly caused by its unparalleled success. Infant and child mortality are very low. Many serious infectious diseases of childhood have been drastically mitigated by improved sanitation and immunization. Because children so rarely die from infectious diseases in the 21st century, when it does happen, it's difficult for us to process. A life lost to infectious disease is viewed as a preventable death. The concept of an infectious disease that is not preventable is difficult for modern society to accept. Before my youngest daughter turned 2, she contracted hand, foot, and mouth disease at her daycare. Hand, foot, and mouth disease is caused by a Coxsackie virus, which is highly infectious and is transmitted by fecal-oral route, as well as through direct contact. The symptoms start with high fever that lasts for a day or 2, followed by sores that appear in the mouth and on the body. These sores are painful and cause quite a bit of discomfort, making it difficult for the child to eat. The result is often a very fussy toddler, which was definitely the case with my daughter. After a few days, the sores began to heal, but they might take a couple of weeks to disappear. Worse yet, infected individuals may remain contagious weeks later by secreting virus in their stool. Anyone who's worked at a daycare knows diapers can pile up pretty fast, and it takes a lot of work to keep everything clean. In reality, it's an impossible task. What's even more important to note is that daycare workers can also spread the virus even if they are asymptomatic. All of this suggests that once Coxsackie virus gets into a daycare, it's going to spread until all the susceptible children and adults are infected and recover with protective immunity. There's simply no stopping it. Yet mortality from hand, foot, and mouth disease is almost non-existent. There's so little threat from the virus that the best strategy of dealing with it is to simply let it run its course. That's not what happened in our case. We were informed by our daycare director that our daughter had to stay home for 2 weeks until all of her lesions had healed, because she might be contagious. During this time, my wife and I, who had professional careers, were expected to continue to pay for daycare that we weren't receiving, and had to make other arrangements for our child, who was already on the mend and posed no real threat to anyone. When we objected to the policy on these grounds, the director informed me that she had contacted the local public health department and that they had agreed her policy was a sound one. This had conflicted with what our pediatrician had told us, which was that our daughter could go back after she had no fever for 24 hours. When we called her to discuss what the public health department had done, she helpfully contacted them to question them further. She told them that she was operating on what the American Academy of Pediatrics had recommended and wanted to know why they were telling the daycare something different. Still, the health department resisted, insisting they were correct. Now, being the stubborn person that I am, I walked over to their offices to talk with the county public health department director herself. She was very amicable, but as stubborn as me, and I could tell after talking with her that she was not about to budge from their decision, despite what our pediatrician might think. Quote, we overrule physicians all the time, unquote, she said. At the time, I couldn't understand this way of thinking. The facts were on my side. Why take the side of the daycare when their actions were not making anyone safer? As I mentioned before, keeping my daughter home would do nothing. The virus is already in the daycare. It would continue to spread until all the susceptible children and workers had acquired it and recovered. No matter if she stayed home or not, no one would suffer any serious consequences. We would be out 2 weeks of daycare for nothing, and I couldn't fathom why. Although I had my suspicions, the reason wouldn't become completely clear until the SARS-CoV-2 pandemic 3 years later. And that was what I mean by the appearance of safety, sort of the idea of that taking precedence over actual evidence-based measures. And I really felt like that was a good anecdote to sort of set up what happened and with the pandemic, and especially how children were treated. So.
It must have been so frustrating to know that you have, all this experience and education on this particular topic, but yet a bureaucrat has decided to overrule you. It reminds me of LA County and Barbara Ferrer and all of the arbitrary guidelines she's, passed down in like the second largest city in the country. And yeah, there is no science behind it. It's just bureaucracy and her will.
Well, I was always curious as to, what some of my colleagues were thinking that, we're back at the CDC, but when you work for an organization like the CDC, you cannot talk to the media. Only the top people can talk to the media. So you'll never know what their actual opinions were. I mean, some of it comes out in their published articles, which didn't necessarily agree as far as like take masks, for instance, with what the CDC was saying that those articles, what their conclusions were. But they couldn't come out and disagree with what the CDC was saying. That just wasn't allowed. And so a lot of scientists, whether they were in the government or not, just felt like they weren't able to, say what was on their minds, and there was a lot of fear there. And I got a lot of emails from people saying, "Oh, thank you so much for writing this article or saying this thing." And I wish I could say that. I wish they could too.
Yasmina, did you want to?
Yeah, I first wanted to say how much I'm thoroughly enjoying your writing. You just have a way of, I don't have a scientific background whatsoever, but you make me feel really smart when I'm reading it. So it's really enjoyable and easy to read. I also really liked the theme of irony that comes across. It's just it feels like a healthy attitude to have with everything that's been happening, to be able just to see how things are so reversed, and then how there's a chance perhaps to undo it with a step back. I don't know if I'm being clear with that. And your point just now about the CDC, there's a certain point where you talk about a 180. And that's something that's really struck me. Like, how did that 180 happen? And how have those people who were involved in that 180 reconcile everything with themselves? It's just been mind-boggling. And that's me just using my common sense, not having your background. And I wanted to ask you a little bit more about what you think about that 180, where people were advising the public with common sense, and then that just all went away overnight.
Yeah, right. If you look at what people were saying at the beginning, it was very sensible. It was very much trying to mitigate fear, and there was a certain point, and that was right about the time that things shut down, which I think was March 16th that week, that the message it changed very, very quickly. And I think the idea was, first of all, it's only people's behavior that's going to make a difference, and it has to be everyone's behavior. And even though the science of previous, pandemic planning documents didn't agree with that, there was still a decision made. And there could be a lot of reasons for that. I mean, one is, people were so afraid that the government officials felt like they had to give them something. Here's what you have to tell me something that I can do to protect myself. And it's not a very good answer to say, well, you know what, there isn't a whole lot that you can do. because this is a very airborne virus, likely. We didn't know it for sure at the time, but it was suspected to be. It's highly infectious. And there are lots of people who have it who aren't going to be very sick at all, so they'll be able to transmit it even before they realize that that's what they have. And that's not a message that our modern society is comfortable with. Like, you don't have control over this. You have to, just live with the probability that the small probability that you might get severe disease or give it to somebody who gets severe disease and dies. That's not something that we are comfortable with, I think, in our modern society. And so some of it was responding to, I think, the way the public was behaving. We have to give them something. And even things like masks, which we know don't really, aren't going to really make an effect on the spread, at least it can give people a sense of comfort. And, they didn't realize necessarily how far that would go in terms of mandates. But at the same time, they want people to change their behavior to be ready for a vaccine, which they wanted to develop as soon as possible. And we're hoping would be a sterilizing vaccine that would stop the virus completely in its tracks, which that didn't happen either. So there's a lot of hubris, a lot of wishful thinking, and a lot of dealing with people who don't want to be told that they don't have control over the situation, and they have to accept a certain amount of uncertainty, which they were unwilling to accept. So I hope that gives you sort of answers.
It does.
what you
It's
said.
really interesting, just to express, like, my thoughts have been changing as I'm just reading your book, because you have such a kindness to, you use your sister as a foil. So right away, I'm more open to hear the other side. And so, while the public health officials went through this 180, I myself I had a 180 in the way that I viewed public health officials. I went from completely trusting them without question to not just not trusting them, but being convinced that they were being malicious because it just did not make sense. And having to, and I know that's not entirely true. I know there's good people that work at the CDC, but it just felt so reckless and so harmful. And in particular, what we had to go through in New York City in the public schools and the mandates, it just felt malicious. And so it's kind of nice to take a step back and maybe consider it wasn't, it might have been not so, you know what I'm saying, not intentional.
Yeah,
So.
It's funny because my sister has kind of, and I didn't say this at the end. At the end, I said something about how she says that she's mended her ways and has, done the research and is not quite as germophobic as she was. But she's actually gone further than that. She's kind of more of a conspiracy theorist than I would ever be. She doesn't believe in a lot of things that she hears, and instead, ascribes a lot of malicious intent to it now. So she's really kind of gone completely the other way and passed me up going,
Yeah.
So, but, and I warned her about the book that I was like, okay, I'm going to use you as an example, because the very first thing I talk about is the wiping down the hotel room. When she first goes into a hotel room, wipes everything down, the phone and all that stuff. That was just too good of an anecdote and sort of a device to sort of introduce the idea of being afraid of something that's always there, that you don't really understand, is always there and you're always exposed to, and sort of the denial of the germaphobe, sort of denying reality, is kind of what I wanted to show in that first chapter. using my sister is gonna work really well. So I'm glad people are finding that, are agreeing with me that was a good idea.
I think Mary was unmuted. I don't know, Mary, you still there?
I just thought I would share a little of what it's like to be a pediatrician and listen and be sort of normal, and so surprised that almost nobody else was. Like, just like you said, that sort of 180, and looking at professionals and people that I would have trusted to give advice about medical care, and see these people, I mean, still very detached from I guess evidence and a understanding of COVID illness in children, which I know for sure wasn't serious because it's been 3.5 years, and I have enough experience with it to know that, but the infectious disease people at our local hospital and so forth are still saying things that don't have a good evidence basis, I think, and it's very shocking to see that. I feel like we were compromised in the office by trying to answer people's questions about on the phone. I mean, I'd spend a lot of time orienting people to just normal infectious disease and immunology and so forth every single day, a million times, with common sense. But our nurses had to answer the question of what are the recommendations. That's what people wanted to know. The parents sort of needed to know that because they were being forced to need to know that by the schools. So we were giving advice, my nurses were, about things like wear a mask in your house, or your child should wear a mask in your house, or stay home for 5 days and then wear a mask for 5 days. And it was actually sort of compromising for me professionally. Like, I felt terrible that was happening. We read all our messages. But so I saw every one of those phone calls go through along with my partners. And there were some things we just couldn't do about that because and one of the worst things as a pediatrician for me was when the vaccine came out for children in that January with Omicron, and there were a lot of requirements for children to be vaccinated to participate in normal activities, and their parents were desperate for them to be able to do their normal activities. So it's understandable, I think, that the parents were willing to do something that would be sort of silly about getting a vaccine or whatever because of they just wanted their kid to play hockey or whatever. But it still is the advice. In fact, I looked today. The CDC was saying you could get the vaccine as soon as you've recovered. People were calling and saying, well, my kid has COVID. What about the vaccine? And the recommendation was get the vaccine as soon as you're not contagious anymore. And that advice was, I mean, I called all my families that I saw that message go out to and said, you don't have to do this. It doesn't make any sense. This is not normal. This is not normal. It makes no sense at all. And even a lot of families with very good common sense would say, yeah, but I can't keep my kid home anymore. I can't take him off of, and so some people did do that. They took them out of all their activities, but some of them decided that it would be better for their child to get a vaccine and move on. And it was terrible. I mean, it's still the CDC, or I don't know if I looked it up on the Children's Hospital newsletter that we got today or a CDC today. Still gives that advice. It's fine to get if you have COVID, wait till you're not contagious, 5 days or whatever, 10, whatever it is now, and then go get the shot.
Allie, You have your hand up? You're mute still. Hold on, you're mute.
Sorry, I unmuted for the coughing. I just wanted to say thank you for having this conversation. In many ways, the pandemic is behind us, but in many ways it's still not, because there's still a lot of flawed thinking and a lot of areas that are less free than I'm enjoying here in Virginia. And a lot of people living with the threat of, rigorous rules coming back because it happened once before. I'm really frustrated. I just wanted to speak to the point of, losing confidence in public health officials. I once revered CDC. I wanted to work for CDC as an epidemiologist myself. One of my mentors was with the Epidemic Intelligence Service. And, for years until the pandemic, until 2021, I revered the CDC and was so proud that we had an agency that was well regarded worldwide. But when things started happening while we were living in Japan on a military base, just a half an hour from the Diamond Princess where it pulled in, I started watching what the decisions were being made and what we were doing to screen people and the reaction worldwide. And I'd go in and talk to, my own personal physician, who's a really brilliant immunologist himself. And because they rotate people through the hospital from different specialties. And in order to have an honest and frank conversation, he would first close the door and speak in really hushed tones. And then I was like, well, that's curious. That's strange. Like, why can't we just talk openly about this? And then I would talk to scientists that I work with. I also help people with their manuscripts. I review them, do basically a proxy peer review. And I have scientific colleagues around the world that I work with. And I was just kind of by email asking them, excuse me, kind of, what are you doing? What are you thinking? I mean, literally in different countries, Estonia being one, Republic of Georgia. And uniformly, the scientists behind the scenes were like, why are we doing this? What's going on? Why are we freaking out over this? And then I remember in April, Ioannidis's article in Stat came out. And that was the first time, like, I remember sitting up in my bed in the morning going, thank God somebody's finally asking some questions here about the numerator and the denominator even. Let's just start there. And it was just such a bizarre diversion from, rational thought, critical thinking, and common sense. And I'm really not sure where that all got jettisoned. Other than part of the safety culture that you mentioned, Steve, and this walking on eggshells and fragility and not trusting our bodies. And I don't really know culturally where that arose. I don't understand how science jumped onto that bandwagon, but we just forgot how to ask questions even about the denominator construction and how you get into the numerator. And even that is basic science. So I'm really frustrated that, I do think the CDC is fully culpable. There are good people there, but they know better. And they totally, I think, just succumb to political pressure. And I still hold them accountable. Like, you can't do that. You're a scientist first, and you've got to speak up. And I think one of the reasons that I was able to is I don't work for anybody. I work for myself. But even that made me feel very vulnerable, because if I am exposing myself as, somebody who's willing to raise a hand and ask some questions, then who's going to work with me? Who's going to work with this rogue freelancer, who has no institutional ties? But over time during the pandemic, I began to be really grateful for that I was accountable to no one but the truth that I sought to find. But I still think that something needs to be done to ensure that this doesn't happen again, because these scientists, all of them know better. And this should have never happened. All of this craziness, like, Dr. Hall, your patients are so lucky you were willing to talk to them and tell them what you actually thought. And, there are
and we own our practice, so I don't work for anybody either.
That's good.
We're 4 partners. I was the only one that was really into reading about this stuff. So I knew what was going on in March or April too, because I saw all those things. It's so easy to look it up.
Yeah.
I mean, so yeah, I think our patients were lucky. I still feel bad about whatever we did that was not perfect. But we did the best we could.
Yeah, me too. I feel badly about, working to keep our hockey team being able to practice. But we were living under the rule of the law here in Virginia before Governor Youngkin took over and kind of dismantled some things. But, I published a paper on how to keep kids playing hockey and keeping the adults in their homes safe, by, trying to keep congested areas down because we did have one outbreak in our lobby, which makes sense. It's a tiny lobby, and we did have COVID go through the team. But we did have vulnerable families. We did have families with chronic conditions, and one of our dads actually was in the ICU. So I'm still thankful that we tried to minimize the harms to the parents at home who are vulnerable while still letting the kids play without masks. But I also bought $40 masks that made by CCM for my kids to fit inside the hockey thing, and that is ridiculous. That never worked. And they really were not transmitting anything on the ice. We watched these kids like hawks. There's no reason kids had to be kept out of sports. And I think we junked the mental health for a lot of kids by shutting down youth sports. And that is tragic. We should have kept those kids playing. So anyway, there's a lot that could be said here, but I just wanted to thank you, Natalya, and everybody for like this opportunity for catharsis.
Sure. And Joseph, hi, how are you? You've been waiting very patiently for a long time.
Oh, I've enjoyed the discussion. Thank you. I'm a cardiologist. I practice in Baltimore, and just wanted to thank you, Steve, for your great book. I enjoyed it very much. I read it very carefully, and I was just impressed about how much it resonated with everything I was taught in infectious disease when I was a medical school student in the late 80s and early 90s. In San Francisco, it was the AIDS epidemic was raging. It was the peak of the epidemic back then. And we, of course, handled that epidemic so differently. I mean, I can't even recognize the infectious disease community and the public health community that I saw and learned to, respect back then. And I'm just wondering what's been the reaction in the ID community to your book? And how do you think the field gets its way out of this mess that they've created for themselves with so much false information and pseudoscience?
Yeah, honestly, I didn't write it for ID people. I try to stay away from promoting my own book among those colleagues. Some of them know about it, and I don't. Some of them are tolerant of it. Not, my own department chair at Indy called my boss here on this campus because I'm on a different campus and was like, "Do you know what he's doing?" And my boss was like, "Yeah, I mean, he's told me everything he's doing." So I didn't write it for physicians. I'm glad that you liked it. And I'm glad that physicians are reading it and scientists are reading it and they're identifying with it and based on their training. And I mean, that's all fantastic. But I wrote it for the layperson, somebody who can understand the basics and hopefully follow the immunology when I get in. Hopefully didn't get too much into the weeds, but that's who I wrote it for. And I try not to change the ID physicians and the infectious disease researchers because, it's hard to change their mind, as you might have encountered once they've decided something. It's very difficult to change.
Well, I mean, we kind of have to wrap it up soon, but I'm seeing Angela's comments about holding governmental organizations responsible. Honestly, I'm not sure that's ever going to happen. I don't know, Steve, do you think, DeSantis doesn't seem to have a great chance anymore. And I think he would be probably, or Kennedy for that matter. I can't imagine either of the other candidates being interested in this endeavor. What about you?
Yeah, you don't see it being brought up in debates or anything like that. I mean, people are not asking about it. They're trying to avoid it. I mean, we wrote a specific document for a group of us for the congressional committee. Our group was called the Norfolk Group with people like Jay Bhattacharya, Martin Koldorf, and Marty McCary, and Tracy Hogue, who I know Allison's worked with some and done some amazing studies that were pandemic related. And some of that we know was used by this committee because at least at some point they've asked several of us to testify during those committee hearings. But in order for something to really happen, there's going to have to be somebody at the top who really wants things to change. And you're right. I think that's not something that's going to happen overnight. People want to kind of just pretend that it didn't happen, even though a lot of the systems are still in place, a lot of the incentives, because I don't think, if you put anybody in charge, and they have that political pressure, and they're head of the CDC or wherever, many people are going to behave the same way. So it's not just getting people in these bureaucratic positions that are different or smarter or, more morally grounded or something like that. It's the incentives that they have to actually promote public health need to be restored or returned or just completely shaken up in order to have them actually think about the public rather than the politics behind it that's driving their position. I mean, that's a tall order. It's something that we have to try to fix, but it's not going to happen overnight. And I wish I could be more optimistic about it. Maybe someday I will be.
Well, there is a federal case against the Biden administration for censoring Jay Bhattacharya, Martin Kulldorff, Aaron Kheriaty, Kennedy, all of the people who were questioning the narrative and were systematically deplatformed and called fringe epidemiologists. So there's at least that ray of hope. I think we have a debt of gratitude to Janine Eunice and NCLA Legal and all of the scientists who did speak out and didn't stop speaking out. And we're in the process of completing our documentary called 15 Days about what happened during that time. We've done about 50 interviews so far. We have 2 more to go, and we're hoping to also release a companion book with some of the highlights from our conversations. So stay tuned for that next year. Steve, thank you so much for joining us, and thank you for writing the book. I remember when I found your first Substack post, I was like, finally a microbiologist speaks out. I was like, it was really agonizing to watch them all be silent, and it was because they were getting funding from the NIH. Monica Gandhi is one of the only ones who's like a heavily funded NIH researcher who actually did speak out, and not perfectly, but pretty well. So thank you for your bravery and for continuing to push forward, and for the Norfolk group, and thanks for being here.
Thank you for having me. It was a good experience. I'm so glad to be featured in your second book club.
That's great. And thanks, everyone. Thanks for sticking around, and have a good night. We'll announce another book pretty shortly, next week or so.